Hey everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about weird things that your newborn might do. Alright guys, so in the past we've done a lot of myth busting when it comes to newborns. So you may have heard some of this information before, but I'm definitely going to touch on some things that you may not have heard of. First up, let's talk about something that we call periodic breathing. So periodic breathing, and the best way I can describe this is just by imitating it, is when the baby is breathing, sometimes when they're sleeping often, and so they're breathing, and then all of a sudden they might go, and then they go back to breathing normally. That can freak parents out, rightfully so, right? Because your baby's breathing normally and then they seem to like hyperventilate and breathe really fast, and then they hold their breath and then they start breathing again. Why does this happen? Because breathing is regulated in the brainstem. Yes, the lungs participate in breathing, but the drive to breathe, the breathing center, is actually regulated by the brainstem. And believe it or not, in the first few days of a newborn's life, the first few weeks, it can actually be immature. And that breathing center sometimes participates in a phenomenon called periodic breathing. Exaggerate this much, much more, and we do definitely see it in the NICU as well with neonates and preterm infants. And we see apneic episodes where babies completely forget to stop breathing, and then their heart rate is affected and their oxygen saturations. With a healthy term newborn, when you just see that breathing fluctuation and then they hold their breath and then they start again, usually you don't see those same kind of phenomenon where you have their heart rate involved and an oxygen decrease in the bloodstream. So that's important to know. Periodic breathing is normal, but on a spectrum, we do definitely see abnormal breathing patterns in the NICU that we keep an eye on. What are some other weird things that newborns do? Hiccups. Hiccups can be completely normal. It actually has to do with the diaphragm getting activated. And that diaphragm lives right above the stomach. So I'm going to throw up this picture right here of baby's anatomy so you can kind of get an idea. But if baby's stomach expands with food, let's say with milk, with formula, then they might activate the diaphragm, and then that diaphragm is just kind of like activated and causing hiccups. It's not a problem. It's not necessarily something you have to jump to, but it is something weird that freaks parents out. And I think it's very fair for parents to understand where it comes from, and you definitely don't have to jump to gripe water. What's another weird thing? Swollen breast tissue. Yes, you heard me right. Why do newborns, including male newborns, have swollen breast tissue? This is actually something we commonly see. And this is something due to crossing of maternal hormones while in utero. It's really important to understand that with this swollen breast tissue, it's normal. It will resolve on its own. It will take probably the first few weeks, and it will definitely start to go down on its own. But it can be pretty dramatic in some cases. You can even see milk expressed from the breast tissue sometimes. I don't recommend that you express the milk. This is something that we commonly refer to as witch's milk, or heard referred to as witch's milk. You definitely do not need to express milk. Just let it be, leave it alone, and let it pass on its own. It's a totally normal finding, but definitely weird. Another weird thing, swollen labia. Now, obviously, this is just going to relate to female infants, but when it comes to swollen labia, why are your baby's genitals looking so obscure? Why are they looking so large compared to the rest of them? Again, it has to do with maternal hormones. When they pass through utero, this is something that we commonly see. This is still within normal findings of a baby's exam. There are other findings that we might see on exam of the genital area that would raise red flags, but this alone, swollen labia, is not something that would be concerning. You can actually see some mucosal discharge, and this is also something that can be very alarming and concerning to parents, but please rest assured that this is, again, something due to maternal hormones. It will absolutely leave the body. You can even sometimes see a little bit of spotting or blood. And again, it's a withdrawal of maternal hormones. So if you can almost imagine what a period is withdrawal of hormones, and you can have some spotting and bleeding. Obviously, babies would not bleed for the same amount, but you can have a small degree of spotting. And again, very normal, very weird, but very normal finding. If you have any questions or concerns, please make sure you talk to your child's pediatrician so that they can get checked out and we can discuss any of the findings we find. Last weird thing that we're going to discuss in this video that your newborn might do that is totally normal is sneezing. So when a baby sneezes, we might jump to thinking that, oh my God, they're sick. There are allergy symptoms, they're getting a cold, they're getting a virus, they're getting sick. And this is actually not true necessarily, especially in the first few hours to days right after a baby is born. Sometimes we see sneezing while they're still in the hospital. And in the newborn nursery, the best way I can kind of describe this to parents is, yes, it's weird, totally understandable, but we sneeze when there's an environmental irritant that our nose senses. And right after we're born, there are a ton of environmental irritants that your child might sense. There could also be retained amniotic fluid as well. If they sneeze, please rest assured that without the presence of fever or any other concerning symptoms and acting normally, this is not necessarily a virus and this is not a cause for concern. So hopefully this video was helpful. I definitely found these were very weird things that newborns do, especially before I became a pediatric resident and learned along the way and saw a lot of babies and saw how normal this was. But when I was a medical student, a lot of this stuff just had me like, what am I looking at? What am I seeing? And is this normal? And I have no idea if a parent would ask me, but rest assured, all normal, but definitely weird. If this video was helpful, give it a thumbs up. Make sure you hit like and subscribe, and definitely join us again next week. Bye.